Hello everybody, my name is Monita Sharma. I'm sitting with Dr. HS Bedi from Ludhiana Mediways. He is the chairman of cardiovascular sciences here. Hello sir, welcome to our show. Sir, first of all, I would like to know that you were quite a distinguished doctor, cardiologist in Sydney already, well established. So what made you come back to India?
See, this was way back in 91, 92 that I was in one of the best hospitals there.
Yeah.
St. Vincent's for some time, which is the adult hospital, and Royal Alexandra Hospital, which is for children. See, but the lure of coming back is always there to serve your motherland.
But actually in this region especially, people want to go there.
Yes. Very true. A lot of people ask me that. In fact, some of my family members also. But I think there is nothing to beat working in your own country and serving your own people.
Yeah.
See, there of course we had a better infrastructure, maybe a better quality of life. But then the feeling that you have that you are helping your own people of India, people of Punjab now, having stronger hearts and stronger blood vessels, that feeling cannot be compared to anything else.
Yes. So sir, tell me something about your initial days, something about your family background. Why did you choose medicine as your career?
My family background, I am from a place called Dera Baba Nanak. This is in Gurdaspur. And my mother's side is from Dayalpur, which is near Chandigarh. My father was in the army. He was a paratrooper, and my mother was a principal of a girls' college. Now, I studied mostly in Dehradun, and my father was posted in Chakrata. If you know, that's a hill station. It's an army hill station. And we used to go there during the vacations, and then on one such trip we had a massive accident. It was on the hill, on the mountain, and we were going up, and there was another vehicle which should not have been coming. It used to be a one-way.
Okay.
And we had a massive accident, and if you can see, I had a very bad injury to my lip. And then the army doctor there, he treated me so well, and I must have been about 12 years old. And that's when I thought I want to become a doctor.
Okay.
So that's how it started.
Okay,
Yeah.
all right. And what was your parents' decision? Were they okay with the fact
They
that
were very happy. They were overjoyed. If you can recollect,
you must be brilliant in your studies.
I was pretty good. Like I went through ISC, and I got one of the highest grades. We were graded over there. But my parents were overjoyed. Like I'm sure 20 years back or maybe 30 years back, it was either medicine or engineering.
Yeah.
If you took anything else, then you were grade B, which is different now, thankfully.
Yes.
So yes, my parents were very happy.
Okay. And then you also married a doctor.
Yeah.
Your wife,
Yes.
Nandini, she
Yes.
is a very famous pediatric surgeon of the
Yes.
region. So, was it a love marriage or?
Oh yes, definitely. Love at first sight.
Why do doctors fall in love with doctors only?
I guess it's a good thing that God has done that, because for a doctor to marry a non-doctor, then it does create friction.
Yeah.
Because you keep such irregular hours, you get up in the middle of the night, so
Yes.
it can be difficult.
Only
to
a doctor
understand.
can understand a doctor.
Yeah. In fact, all my siblings, we are all doctors. I have two sisters.
Okay.
Elder one is a doctor, younger is a doctor. Their husbands are doctors. So we have 6 doctors in the family.
Okay. So you must have got a lot of family support as far as,
yes.
building your
Definitely.
career was concerned. But were there any struggles that you had to face, especially when you came back to India? You had to,
See,
start everything
mostly
afresh.
it's a shock if you've been away for too long. So
Yeah.
you should not be away from too long if you want to come back. It is a little bit of a shock, but then you're born over here, so it's not that much of a problem. Infrastructure wise, we are as good. In fact, my chief from Sydney, Dr. Mark Shanahan,
Okay.
he came twice. He's such a actual teacher, actual mentor. He came specially on his own twice to see how his student was doing, and he came to my hospital, and he was very happy and he said, we were working in a transplant unit, so he said, Harinder, you have transplanted the knowledge of Australia to Punjab.
Wow.
So that's I had a lot of support, yes.
Okay.
But the mental block, I worked in Delhi in the Escorts Art Institute, which is one of the finest
Yeah.
hospitals. And there I realized that every week I was operating 4 to 5 patients from Punjab.
Okay.
So I said, why should people have to travel to Delhi And at that time there was nothing in Punjab.
Okay.
So we started the very first cardiac unit in the private sector in Punjab. So that was a mental block. People would not recognize or accept that cardiac surgery can be done in Punjab. So that was the mental block.
There must be trust issues also.
Yes,
because
and,
people think that getting surgery done in a place
yes.
like Bombay or Delhi,
Exactly.
that would be much better.
In fact, the very first few cases that we did were rejected from Delhi, from my own hospital in Delhi.
Oh.
So we took that as a challenge, and mostly by God's grace, they did well. And once you do that, then people's trust builds up. So that is the main thing.
Okay. So why do you think that heart diseases are so much on rise these days?
Oh yes.
And especially in young people also.
That is the main concern. I have operated last week a fellow 35 years old, and he was a hotshot executive of a bank, one of the multinationals. So I asked him, I said, hey, you have a cushy life, you are paid so well, like we can't even imagine what you are paid, because doctors are paid very less. So anyway, I said that
Really?
Oh yes.
Okay.
To begin with, at least.
Okay.
So he said, doctor, you can't understand, you can't imagine the sort of pressure we are under. And then when I sort of investigated, all professions are under pressure. There are deadlines, there are results you have to give. That's the main reason. Stress is the main reason.
Yeah.
Of course, there are other reasons, but stress is the one thing which is increasing. Now, like food habits are getting better.
Yeah, people are getting aware.
Yes, people are exercising. If you get up in the morning, you'll see a lot of people exercising. So some things are getting better. Tobacco is almost reduced quite a lot in Punjab. Even in Delhi, we had tobacco smokers or Bidi smokers. That is reduced. So only thing which has gone up is stress and diabetes. So diabetics, we are the diabetes capital of the world. So almost 50% of our adult patient is a diabetic. In diabetics, heart disease is very common. So I would label stress and diabetes as the main reasons.
Okay. So you've done a lot of work in beating heart surgery as well. So please tell us something about that.
See, when we do heart surgery, the commonest heart surgery, the bypass surgery.
Yeah.
Maybe I can show this to
Yes, sure.
you. So that's the heart.
Okay.
And it's the size of the fist. So my fist, usually in all people, that's the size. And the heart is a pump, so it has to pump regularly. It can't stop. If it stops, then that's the end of life. And so it needs a power source. So the power source is oxygen through arteries. So these are the coronary arteries, the heart's own arteries. This red. And if there is a reduction in the blood supply, commonly by a blockage, then that causes a heart disease. That's the commonest form of heart disease. And the treatment for that is a bypass surgery. So we just keep this here. And in bypass surgery, what we do is we bypass the block. So if there's a block here, I'll put a graft beyond it. To do that, we had to stop the heart. Now if you stop the heart, then you need to have something to take over. So that's called a heart-lung machine. And the heart-lung machine, one, it's expensive, it's imported. Two, it's causes a lot of there's 5 liters of blood churning in the machine, so it damages the blood, damages the brain to some extent, damages the kidney. So we thought that in some patients we were not able to do the surgery. If he had already compromised kidney or his lungs were not too good, then we said, we are sorry, we can't operate on you. We know you're going to have an heart attack, but there's nothing else we can do. So we had one such patient in this very state of Punjab. He was unfortunately refused from a number of good centers. For good reason, his lungs were very poor. He's from Sirsa. His name is Mr. Labh Singh.
Okay.
And so he said, doctor, you have to do something. Whatever you want to do, you go ahead. So we had at that time devised a new technique in which we were able to do a graft without stopping the heart.
Okay.
That is called a beating heart surgery. But we were doing it only for single vessel. Now there are 3 or more arteries. In him we needed 3 grafts. So we explained to them, we said this is a new technique for 3 grafts. If you say, we will try it. So he gave us the go ahead. And by God's grace, by good skills, he did well. And then we did hundreds of cases. These are beating heart surgeries and with angiograms. And this was not just the first in Punjab or in India, it was the first in the world.
Wow.
And so we have a Limca Book of World Record on that.
Okay.
And after that, this technique and its modification, we have so many good surgeons in India, surgeons much better than us. and they added their techniques, and it revolutionized the way we do heart surgery. Now 99% of my surgeries and of my colleagues in good hospitals in India are beating heart surgeries. So advantage, cost is less, recovery is faster, third day patient goes home. His lungs are not damaged, we hardly need blood, his brain is not damaged. So it's a plus win-win situation. So that's beating heart surgery, and now the world is also learning from us. Rest of the world is doing about 30% beating heart. In India, it's more than 90%. And sometimes we get surgeons from abroad who come and take our help to learn this technique.
And what's the latest in endovascular surgeries?
See, the other end, before we go for endovascular, let's talk about, there is something called vascular disease, which means blockage of the arteries, maybe of the, after the heart, the arteries which go into the rest of the body. Again, in diabetics, for example, the legs, the arteries can get blocked. The standard treatment was, we used to do open surgery, replace the artery, bypass the artery. Sometimes there is an aneurysm, it swells up, so we just remove it, put in a new graft. Now this is a very effective technique, but it was a major therapy. Now in endovascular, what we do is we thread in a tube. So wherever the block is or wherever the aneurysm is, aneurysm means artery is dilated. We go over there and we put in a stent. So the stent forms or is equal to the size of the normal artery there. If there is a blockage, it removes the blockage. So that's endovascular surgery. All you need is a one tiny hole in the groin, and there is no cut in the body. So that's again another revolution, and we are quite happy that we are also part of that.
So it's minimally invasive.
It's a type of minimally invasive surgery, and it's really going to catch on in the future. Most of our procedures will be replaced, vascular procedures will be replaced by endovascular.
All right. And so you're also proponent of yoga, if I'm right. So how do you think yoga can play a role in, helping us from heart diseases?
See, yoga, or actually it should be called yoga, that's the actual word.
Yes.
And it's a fantastic thing to know, but we should not go overboard. It will not cure, I don't believe that it will cure heart disease.
Obviously it cannot replace surgery in any case.
If you do it from a very young age, it can prevent heart disease. So it's phenomenally good in preventing heart disease. Once you get heart disease in the earlier stages, it can prevent progression of the disease. But once disease is severe, then we don't say to do yoga. But yes, if a patient who comes to me needing surgery, even if I do beating heart surgery, I know that his recovery will take 2, 3, 4 days. I teach this patient yoga. I have a yoga acharya, trained yoga acharya. So we teach these patients under supervision. You cannot make them do the very complicated asanas. Mostly it is to do with the lungs. It's mostly pranayam. And we found that if they do yoga, and most of them learn very well, especially kids. I'm so happily surprised. Children pick it up very fast. And if they learn yoga for even one day, and after surgery their oxygen capacity is better, their lung capacity is better. We can remove the machine, that's a ventilator which gives breath to the patient. We can get it off very fast. And the recovery is really phenomenally good. In fact, we have done a very detailed study with measurement of oxygen content, PO2, which is amount of oxygen in the blood, and we found that we could actually quantitate. It's not good enough to say my patient is doing well. The scientific community wants quantitation. So we could quantitate that his PO2 is better than the next person who did not do yoga. So that is really great. And it's not just the patients, my own staff, nursing is a very stressful condition. So we have 10-minute breaks, and all of them are voluntarily, they do yoga. So we do yoga not only for patients but also for our staff, and the staff is very happy. So they come forward that new staff says, let me learn it also.
Wonderful, sir, wonderful. So coming from a doctor like him, we certainly have a lot of reasons to believe in the power of yoga now.
Yes.
And sir, let's talk about your family life. They say that behind every man's success there's a woman. So does that hold true in your life?
Obviously, 100%.
Really? So tell me how Dr. Nandini has, played the role of, not just a perfect wife, but also a perfect companion when it comes to your professional life also. So please let me know, please let our audience know that
See,
what has been
basically,
her role in
it's
your
what
life.
you need is understanding in the spouse, because you're going to keep long hours. You're going to miss a number of birthdays, and you need. And it's actually, in her case, it's both ways, because she's also a surgeon. So she also has, I'm sure, been helped by my understanding that she needs a long. And what I'm thankful for to her is that during my initial period, then we could not have both been working. So for the first couple of years, she took a little break. So that helped me to get started on my training and then my work. So definitely without that backup system, I may not have reached where I have reached today. So I'm sure she'll say the same thing about helping her. So it's mutual actually.
Okay. And please tell me about your hobbies. What else do you do besides
I'm a
work?
voracious reader.
Okay.
I love reading. I do a lot of trekking. I used to take part in marathons. In fact, in 2005, when the Delhi Marathon was the first Delhi Marathon, I was the only participant from Punjab.
Okay.
So
Wow.
I am not that active now. So trekking, reading, and taking part in marathons. That definitely. And then I love traveling.
Okay.
So I have traveled almost the whole world, and even parts of India which I never thought existed. So we have lovely places in India itself.
And so, what's your general motto in life? What's your, advice to the budding cardiologist? I know it's a very demanding profession, and children these days, they want shortcuts in life. So, what is your advice to the young
Firstly,
generation?
there are two things. And it's a common mistake. The cardiologist is my colleague who does the medically related procedures. Like angiography, angioplasty. I am a cardiac surgeon.
Okay.
So although our definitions are getting blurred, like I am doing more and more endovascular, and the cardiologist is doing more and more invasive procedures. So now somewhere down the line probably we'll be a hybrid. At the moment we are cardiologists and I am a cardiac surgeon.
Okay.
Now a lot of people, children, we are in the age where our children have grown up, and my colleagues' children, they'll come to me and ask me, what do you suggest? Should I become a doctor? So in this current scenario, I say, if you need to ask me, then please don't become a doctor. Because you have to have the passion in you. Yes, I want to do something. Otherwise it's a very taxing profession. It takes at least 15 years before you can say that you become a doctor who can operate or who can run a clinic independently. So yes, but it's very satisfying. A simple thing like just seeing the smile on the small baby. We have something called a blue baby. That's a very common defect. There's a hole in the heart.
Yeah.
The blood mixes, and the poor child is black, cyanosed. He's blue, so that's called a blue baby. And some of these, or most of these, can be treated by surgery. And the moment you correct it, he becomes pink. So that is such a rewarding feeling you get. And when that kid smiles, or the parents smile, or even an adult, when he's almost dying and you're able to treat him. So there is nothing, it's priceless actually. There's nothing to beat that.
Yes, yes. So is there any surgery that you remember till date that you perhaps thought that it's impossible to treat this patient, but the miracle happened?
I think all of us surgeons have so many cases like that. The most important one was, I told you, Mr. Lam Singh.
Yeah.
One, he was refused from centers for good reason, not that they were not brave, it was a high risk case. Two, it was an absolutely new technique that we are trying, and it was, we had to take his consent, his family's consent, and in fact they pushed us, I'm dying anyway, so please go ahead. And we used the technique which we had devised. So that that case is very much in my mind. And now today he is about 20 years post surgery.
Okay.
He is 88 years now, and he comes to me every year in June when he was operated. And that was one of the most difficult surgeries. Not just technically difficult, it was because it was the first in the world.
Yeah.
Supposing something had gone wrong, then I probably would not have...
confidence would have shattered.
would have blamed myself. So We are very happy that, and there are so many cases like that, and innumerable.
Yeah. Thank you so much, sir. Thanks a lot. Pleasure talking to you.
It was my pleasure. Thank you, Monica.